My name is Charlie Carroll. I am the clinical coordinator of the Sleep Center at Henry County Medical Center in Paris, Tennessee. I attended Lambeth College in Jackson, Tennessee, majoring in science. I received my polysomnographic training under the direction of William C. Dement at Stanford University in Palo Alto, California. And I have been in sleep for 34 years. The sleep lab is a state-of-the-art facility. We have technicians who work at night, who monitor the patients, receive the patients, discharge the patients. For a patient to be referred to the sleep center here at Henry County Medical Center, they would have to have an evaluation with their primary care physician, or PCP, their provider. Once it's determined that the patient would benefit from a sleep study, then they would actually set the study up, the study date, and give it to the patient. And then the patient would come to the sleep lab, and have this testing performed. A tracing and recordings are gathered together. Those are looked at and scored. Sleep architecture, events that may occur during the night that disrupt the sleep. We have 4 beds, and we have 2 technologists who work at night, and myself. Well, the patient, once they've been approved and an order comes from their PCP, which all sleep studies have a written order. The patients are admitted to the sleep lab. They are given questionnaires, bedtime questionnaires, sleep questionnaires. Once they become acclimated to the surroundings, the technologist will wire them up. What they'll do is they'll put sensors to measure brain waves, eye movements, muscle tone, limb movements, heart rate, oxygen saturations, airflow. And then when they're ready to go to bed, what they will do is they'll have a lights out and the patient's allowed to sleep throughout the night. If they have to get up for some reason, which most people do, or a lot of people do, then it's a very simple procedure. Go in there, disconnect a few wires and let them go and say go to the bathroom, or if they just want to sit in the chair for a while to get reacclimated. After the study is over, they are awakened. They are given a cognizant evaluation to make sure that they're coherent, that they can actually perform tasks like driving home, or they'll have someone come to the sleep lab and drive them home. Once that is done, the record is scored. All the sleep stages are staged. All the events are scored. They are sent to our medical director, who actually does an interpretation of our data. We are evaluating their sleep, how well they sleep, the different stages of sleep. There are basically 4 types of sleep that we look at. There are stages, stage 1, stage 2, stage 3, and there's REM sleep. It's important that we see all the stages of sleep because some people who have events with their breathing at night, it can worsen during stage 5 sleep, which is REM sleep. To function and be a normal person during the day, you have to have enough sleep, whatever that quotient may be for that particular person. 6 hours, 7 hours, 8 hours. The idea is to have enough sleep that you can function during the day when you're supposed to be productive. And overall health as well. A bad night's sleep or disorders that affect your sleep can also cause many other problems and symptoms that patients have.